It's Ruth Armstrong here from Croaky, and I'm talking to Professor Don Nutbeam, who's just addressed the CPHCE forum this morning. Look, with a little bit of a walk through our thinking on achieving health equity over the past 25 years or so. Professor Nutbeam, you talked a bit about the way that we've swung from in the 80s, thinking of public health being about personal responsibility, through to more of the thinking we've had more recently about it being more about the social determinants of health. You think we might have thrown the baby away with the bathwater a little bit. Can you explain a bit about that?
Yes, so I think I've been part of the pendulum. I think it's fair to say, in the sense that I got very distressed at the focus on personal responsibility, and became part of an overreaction to that. Where the sense was that all we need to do is to fix the social determinants of health, and not necessarily bring people with us. I suppose what I feel I've learned over the decades of involvement in public health is it's not one or the other; it has to be both. We'll never successfully and sustainably address equity issues in health without addressing the social determinants in education and housing, employment, poverty. But we won't successfully address those without engaging people in the issues.
Yeah.
Communicating with people continuously, and ensuring that our health education not only involves reminding people of the things that they can do for themselves, but also getting people to understand and recognise that there are things that we might reasonably expect governments to do on behalf of them, and to win their support for doing that. So it really is a message that it's not one or the other. It's important that we do things for and with people, and that we're not doing things on them, to them, and to do that we have to communicate using the widest variety of media messages that we can.
I noticed that you've been looking at health literacy and health literacy capabilities all around the world. Can you think of a model anywhere at all where this is happening, where you think we're getting the balance right?
Yeah, I mean, of course, every country's situation varies. So I've had the privilege of working in China and the US and Germany, all of whom have national strategies to improve health literacy, and each of them is approaching this differently. In China, it's a very centrally led approach. In the US, it's a highly devolved approach, and in Germany, for example, there's quite a nice balance between what they are trying to achieve through national action to improve health literacy, and what they're asking for locally.
Yeah.
I guess the answer is it depends on the local circumstances. So I actually think that after a long time of highlighting issues of poor health literacy in the population in Australia, 25 years in my case, I think it's fair to say that governments at both state and national level, and a lot of health organisations, now understand and take much more seriously the importance of engaging their communities and engaging patients much more meaningfully in decisions about health and healthcare. And I think that's leading to some much more innovative, creative and impressive health education and patient education programs using a whole range of new and old media. I think we are getting there in Australia, and we are getting much higher level of more meaningful engagement with our populations. But honestly, we've got an awful long way to go.
Yeah. Well, on that hopeful note, I think we should end. You've had a long morning. Thank you so much for talking to me.